Vanessa tells us that we're on.
Oh, okay.
We're on. Okay.
I don't know about the shoes thing.
The shoes thing? Well, I think you won't talk about the shoes thing when we get to it.
Okay.
Fine.
So, okay, it's Tuesday, April 28th, and we're back again for more. So, Randy, why don't you start us off? How was last week?
Back again for more. That's a good way to put it. No, last week was great. We had our Freedom of Choice Advocacy Day. I think overall we had about maybe 80 people show up.
Almost 100, actually.
Almost 100. Okay. So yeah, so that was a really good turnout. That was the goal, is 100 people. So I was really happy about that. I got a chance to go with some other supporters to their legislative meetings, and I also went to my own legislative meetings. People are just really excited. They're really happy to be networking. Representative Fetter was our keynote speaker, and she did an awesome job.
That she did.
I was really, really just so excited to see her. The church was beautiful. Trinity Episcopal Church is a really beautiful church, and everyone there that works there is so nice and really opened it up to, for us. Fresh Box, which is a nonprofit cafe that's in their basement, who provided the lunch, and it was awesome. Um, some people may or may not have taken extra chocolate covered Oreos. It's been put out there. We don't know. They are delicious.
Don't know
That
where
they
they
are.
went.
So if you are ever in downtown for lunch, yes, definitely patronize Fresh Boxes. Are awesome.
It's a third and broad.
Yes,
That
thank
is.
you, Gabe. The rally, I'll let you speak. I was actually in one of my meetings when the rally was going on, but I did see pictures. It looked like it was really great.
Yeah, it was great. It was an awesome opportunity for our supporters to hear from a bunch of legislators who actually agree with us, because unfortunately, because of the majority of anti-choice members in our legislature right now, a lot of our people had to meet with people that didn't agree with us on the issue.
Yeah.
So
Right.
Kathleen Clyde kicked it off, did an amazing job rallying up the troops, and
Teresa Fetter took over from there.
Yep, she
She
did.
talked to the attendees during the workshops in the morning and then was back for the rally in the afternoon.
yeah, and then followed up with one representative that's been around for a while, Heather Bischoff, and then Michelle Lepore Hagan spoke about their Prevention First bill that they have in the Ohio House, because really what we should be focusing on is increasing access to healthcare, not decreasing access to healthcare. And then we ended it off with two members.
Nope, Senator Capri Cafaro was in there too.
Yeah, two
Yep.
members from the Senate. So we did Capri Cafaro. I'm talking about the Senate bill, Prevention First bill, and then
Lepore Hagan.
no,
and Bischoff.
Tavares. We did that already.
We did that already?
Yeah, I talked about them already. So it was Clyde and then Fetter, and then Lepore Hagan and Bischoff.
Right.
And then we rounded it out with the two senators, Capri Cafaro and Charlita Tavares from Columbus.
This
Right.
is
talking about
live,
her.
live TV people.
But they were talking about
Boss's
separate
bill.
things. It was
Yes.
Cafaro doing Prevention First
Yes.
with the others,
Uh-huh.
and then Tavares talking about
That it was.
the
Not
boss's
my boss
bill.
Business Act, yes.
Yeah.
'Cause
So
your
let's
boss
go out of order since we're talking about those now. What's the Ohio boss's bill?
The Ohio Bosses Bill actually comes out of the Hobby Lobby case in the Supreme Court, where the Supreme Court actually decided that your boss could decide what kind of healthcare you had access to by denying you access to contraceptive coverage.
Right.
So, but they left the door open to say states could come in and require companies that operate in their state to put that coverage in their insurance plan. So that's exactly what Senator Tavares's bill would do, is make sure that your boss couldn't control what kind of healthcare. So they couldn't discriminate against you because of your reproductive healthcare decisions, and they couldn't take away your access to ACA mandated, Affordable Care Act mandated contraceptive coverage in your health plan.
Okay. So this sounds like a continuation of that whole hashtag not my boss's business campaign that was going on over the past couple of years.
Yeah, I mean, this is not the first time she introduced it. She introduced it last session when all that was happening. And because it got absolutely no traction at all whatsoever, not surprising, that she introduced it again this year.
Okay. And so on that same line, Kathleen Clyde was talking about equal pay. Randy, what do you think about equal pay?
I would hope that no, I think that's a very important thing. You know, I see a lot of people when they talk about equal pay, they try to say that, oh, well, women are just not as good negotiators, or women are taking jobs that just don't pay as much, and they're not getting degrees in, like, engineering or science and technology. But the fact is that when you take into account, experience, education, there still is a gap. And but
Right.
people say that, oh no, it's not happening. And the fact is what, 76, 77 cents for white women, is 68 cents for black women,
That's right.
54 cents for Latina women. So I mean, to say that that's not something we need to focus on. And also, people don't think about, a lot of women now are head of the household. So when you're saying that you're not going to pay them as much as men, then that's not only affecting them, that's affecting children too, because they're single mothers and they're having to take care of all the bills, and they're not making as much as their male counterparts. So I think, the equal pay is something that we definitely need to do. And I know that, the president signed in the Lilly Ledbetter Fair Pay Act, but basically all that meant was that, now you can, if you somehow do find out that you're getting paid less, that, you can sue, which is a good thing. But at the same time, a lot of places, they still discriminate. They still tell you to not talk about it. I've worked in offices where they're like, you're not supposed to talk about your pay.
Well, that's what Clyde was trying to do. She actually introduced a amendment to the budget last week to ensure that if you were talking about your pay with your coworkers, you couldn't get fired for doing that. And then also would require companies that were doing business with the state to disclose their salary levels. Say that 3 times fast. So that we would know that we are contracting, if we were using state tax dollars to do a project, we were contracting with somebody who paid their employees equally. And what was ridiculous about that, and like had me jumping out of my seat in the gallery watching it, was Representative Dorothy Polanda, another woman, stood up in opposition to this amendment, saying that it was discrimination against businesses. Here's a woman who gets equal pay because it's mandated by law. Her salary is going to be exactly the same as her male counterparts because it's protected by law, saying that other women shouldn't be protected by law. And man, that just made my blood boil in that chamber that day. There were lots of things that did that, but yeah.
That's crazy.
It was ridiculous.
We're discriminating against businesses
because
corporations are people. In case you
exactly.
didn't know that, corporations are
people,
people
my
too,
friend.
and we don't need to discriminate against them by making sure that they pay their employees, a fair wage and equal wage for men and women.
Yeah.
We go about that.
We could do a whole episode.
Corporations get a lot of things that individual people do not get. So
Someday we should do a full episode on equal pay. It sounds like we definitely have the energy. I want to close out that segment though by asking you to repeat the one part, because I've heard it before. It's not always included in the discussion, and I do not have the numbers memorized the way that you just fired them off.
Oh,
it's for white women. It's what's the gap?
It's about 77 cents for, and this I might be off by like 1 cent, but it's close. Just a disclaimer, 77 cents for white women.
For black women,
64 cents.
64 cents.
And for Latino women, it's like more like 54, 55 cents.
So that's
almost half.
Yeah. So that's half pay if you're a Latino woman. That needs to be a major part of how we talk about this. It's not always included. So I think that's important to repeat over and over and over again until more people hear it for the first time. So,
and actually, Rep. House did actually speak after Clyde introduced the amendment on that fact on the floor of the House as well. So,
those are 2 out of the 3 good pieces of legislation we're looking at now. The third is the return of prevention first, as we said. Michelle Lepore Hagan and Heather Bischoff in the House, and then State Senator Capri Cafaro is introducing it on her side. This is legislation that we've seen before. It's still needed.
Yeah, definitely.
Back when I started working in reproductive rights, Prevention First was a series of breakout bills. There was one bill that was kind of all-encompassing, and then there were parts to it. What are the exact areas, the specific areas that we're looking at? We've got emergency contraception, requiring it to be in emergency rooms.
Yes.
What are the other parts that we're looking at?
Ensuring that pharmacists have to dispense birth control, including emergency contraception, if a woman has a valid prescription for it. Right now, there's no a law protecting that. We actually saw a case out of some state in the South, I think, recently,
Georgia, of course, my home state.
Where a woman who was miscarrying was denied a prescription because it could also be used as an abortifacient.
Right.
And so, so this is very much still needed. And it requires schools that do sex ed to do comprehensive sex education. So schools could no longer do the scare tactic abstinence only sex ed that does nothing to protect young people. And then also has a contraceptive equity component such that insurance plans would have to cover prescription contraceptives at the same level they cover other prescription drugs. So a little bit similar to the Boss's bill.
Right. Okay. So these are all some terrific things that'll help to prevent unintended pregnancies, some sensible solutions that are an alternative to the abortion bans,
Exactly.
which are still out there. So
Yes.
abortion bans are some of the bad legislation that we're fighting. The other stuff, though, that I think we're going to talk about today is what's in the budget. There's additional funding, $500,000 for crisis pregnancy centers, the storefronts that act like healthcare providers. They lie to women. What else is in the budget?
Well, we're still facing cuts in Medicaid optional programs. So we're going to eliminate 3 programs that are used for low-income men and women, one for pregnant women and another for people who've been diagnosed with breast or cervical cancer. And that one's really interesting because we're going to keep the screening program, but we're going to get rid of the program that actually helps them afford treatment. So we're going to screen you for breast cancer or cervical cancer. We're going to diagnose you with one of those cancers, and then we're going to tell you, sorry about your luck. Have fun. And then the third one is a family planning optional program, which allows people to enroll for Medicaid just for defined family planning services like pap smears, birth control, STD treatment, prenatal vitamins, so that women can plan when they get pregnant. Novel idea. So all 3 of those programs would be cut from 200% back down to 138 if the budget goes through the way they do. And what was really amazing about that is Representative Amelia Sykes, another rock star, introduced an amendment to reinstate those eliminated programs, and did a really amazing job of calling out her supposedly pro-life colleagues who say that they care about women and babies for voting to eliminate this Medicaid program for pregnant women, which is just ridiculous. So she did a really amazing job on the floor too.
Okay. Sounds good. So then looking from legislation to justice, different kinds of justice. Today, there's something big happening in the Supreme Court. It's oral arguments, right?
Oral arguments on the marriage equality cases. So,
Yay.
it'd be better if we didn't have to be here in the first place. And Ohio's Sixth Circuit Court just ruled that marriage equality was good. But Sixth Circuit conservative, they did us wrong again. And so kind of forced the Supreme Court's hand on this and kind of forced them to hear it because all the other district courts had said, yes, it's unconstitutional to deny.
Ohio's included in the states that are in front of the court right now.
Yes. So it's Ohio, Michigan, Tennessee, and Kentucky.
Okay.
Are the states in our circuit court. They were all here. They were all heard this morning. I have not seen the transcript yet, but I'm sure we will. We'll be excited to see, what those arguments are. And as everything in the Supreme Court, it'll be June before we hear anything about how it's going to be ruled on. So we'll just kind of have to wait and see.
Okay. So that's the Supreme Court. That's good news.
Yes.
Hopefully.
Also, in the world of justice, last night was one of those sort of holy shit, watch TV moments in Baltimore.
It was very sad. I've been watching it a lot, obviously, and I've been on Facebook a lot, which, again, as I said earlier, I'm from Georgia, so I have a lot of friends from Georgia. And so I love you guys. Bless your heart is all I can say. No, so if you don't know what's going on, which I'm sure you do, but let me just recap a little bit. Freddie Gray is a 25-year-old man from Baltimore who, I'm forgetting the date. It's been about a week though.
I think the 17th.
17th? Okay. So he was in Baltimore with some other friends. And basically, and this is from the testimony of the police officer, he made eye contact. And after he made eye contact, he, for whatever reason, actually, I shouldn't say for whatever reason, because as a so he ran and the police ran after him, and he was subsequently arrested. And you can see, they show video of him limping, and he was put into a police van, and they did not put him in a seatbelt, which they're supposed to.
Right.
And
So
they
he was
gave
in the
him a
back of
quote
a paddy
unquote,
wagon.
yes, and they gave him the quote unquote rough ride, which
Right.
also I found out last night watching the news, that he's not the first person to from Baltimore to be paralyzed from getting one of those rough rides.
Right.
So he was paralyzed, his spinal cord was severed, he went into a coma, and he died.
Right.
And
So
thing,
the term rough ride exists because it's
yes,
something that has existed.
Yeah.
exactly. Yeah, and so the thing is, it's like, the crazy thing about that is that he wasn't doing anything. He looked at the police officer and, okay, so
Yeah.
that's enough for you to chase me, to run after me. And you know what? I'm a Black woman, an educated Black woman. I live in a good neighborhood. But do I want to be around police officers? No, I don't. And maybe when I see one, maybe I'll avert my eyes too. Are they going to chase me down and kill me? Like, that's really the question. And are we at the point, it's 2015, it's not 1932? Are you, as a Black person, are you no longer now allowed to even look at police, and they're going to try and chase you down? Like, that's crazy to me. I think that's ridiculous. And yeah, I mean, that's just so crazy. But, and so what happened in Baltimore right now is, it's a lot of people peaceful protesting, but I feel like also the media, of course, is not showing the peaceful protests. It's showing a lot of, rioting. And at the same time, if you're a young, poor, uneducated person, and you're living in the circumstances, you feel like, your life can be cut short for now simply looking at the police the wrong way and feeling like, okay, I want to get out of this situation, so I'm going to run the other way. I would be pissed off too.
Yeah.
I would be very pissed off too. I am pissed off, and I was there. I would be pissed off just as much as they are. And no, I'm not saying that rioting is okay and that you should be breaking things or burning things. But at the same time, it's, people are, and people want to look at that and say, oh, why are they doing that? Rioting, that's not going to, change anything. It's like, no, but that's not if that is what you see, if that's the part of the story that you have the biggest issue with, then you need to wake up, because you're not paying attention. That's not the biggest issue you should be concerned with. So basically, you're saying that these businesses, these broken windows, these cars are more important than these young Black people who are being killed, more important than trying to say, well, why? Well, why is that stuff happening? And if you think it's in a vacuum, it's happening simply because they're Black. It's not. That's called racism. It's not happening in a vacuum. There's a lot of other extenuating circumstances: poverty, lack of education, lack of health care. I mean, if you lived in that situation and you feel like nothing was going to be done about it, nothing is happening about it, you would be mad too. So I think a lot of people should try having a little empathy for that situation, and saying that, like I said again, no, rioting isn't, a necessarily most productive or an effective way to affect change. However, again, if that's your situation,
well,
it's okay to get pissed.
And you have nowhere else to go. I mean, we were talking just about the wage gap a minute ago.
Yeah.
When you look at unemployment rates between white people and African Americans, we talk about how we've recovered, the economy's better, we're all good, we've made through the recovery and we're on the other side. Unemployment for African American, especially young men, is I think 4 or 5 times what it is for white young men.
It's easier for a white man with no high school education to get a job than a Black man with a college degree. So you just think on that again.
Yeah. So
Like that's the reality of the situation though.
so when you really have nowhere else to go, that's where the anger and frustration is. And I really, part of reproductive justice is making sure we can live in communities that are free of
Exactly.
violence, so that a
Exactly.
mother can send her kid out to go to school that day and be assured that that child will return home safe that afternoon. And in so many communities around the United States, that just doesn't happen anymore.
That's
Yeah.
right.
So it's a sad
Yeah.
statement on where we are.
And I just wanted to put out there before we move on, that, while it is also an issue of, people always, think about, individual racist people. I'm not concerned about individual racist people. If you want to be an individual racist person, like I say, do your thing. That's not what I'm concerned about. It's systemic and institutionalized racism that people don't talk about or think about. And also
I think it's harder to spot.
it is. It
Yeah.
really is, because people see it as, oh, those are bad people doing bad things.
Right.
Wherein it doesn't matter what color you are, we all feed into that system because it's a system that America was built on. And so what we need to be worried about is not necessarily the black and white of it. First of all, we need to worry about green, who has the money and the power, and also blue, because we see, as we were talking about earlier with Walter Scott, that was a black female cop that showed up and watched him, put the taser there or whatever, or who didn't offer him any, medical assistance. And so that's the institution of policing. So they need to look at themselves. And also, because people's in Baltimore, the police commissioner there is black, the mayor is black. So it's not about, like I said, yes, there is racial issues there, but it's not just about that. It's about the whole institution of policing, that they have a lot of things that they do wrong. They need to look at themselves that, need to change.
Yeah. The systems.
Yeah.
We need major system change for sure.
Exactly.
Okay. On that note, I went bowling this weekend.
Yes, you look so good.
That's a segue.
Yeah. Total lack of segue. I went bowling. So,
but it was bowling for low-income women to have abortions.
Yes,
so
for a good cause.
This was the first time since I've been in the movement where I've got to participate in the Women Have Options Ohio annual bowl-a-thon. It's part of a series of bowl-a-thons that take place all across the nation. The Ohio one raised $24,000.
Wow.
All of that goes to helping low-income women obtain abortions here in the state of Ohio. It's their big fundraiser. I was on a team with some friends of mine who all got together because they operate a little business. So shout out to Clover's Hemp. They threw me onto their team. It was a great night. So if you
I saw pictures.
yes, I
took one for the team and wore the Lady Liberty costume.
Yes,
it was
I dressed
fabulous.
up as the official NARAL mascot of the Statue of Liberty. Got some funny pictures there.
How was your bowling?
It's while this is a great event, it is not one for serious bowling. Because me and the other husband who was on our team, we got down there and we put on our shoes and we selected the balls that we wanted. And, you sit down at a little computer and you type in everybody's name, and then we looked at each other and realized that nobody else on our team was anywhere near our lane. It was like, oh, we are not going to get to bowl today, are we?
Wow.
So, as with any other social bowling situation, normally, half the people there are only mildly interested in actually bowling.
Yeah.
And the other rule that I've learned is that fewer than half of the people are interested in the last game that you bowl. Like everybody's excited for the first one. Yeah. They'll roll the ball and then the third frame comes around and they're only halfway into it. The last game is always regrettable.
Oh yeah. So, there's always one where you go one too far.
Yeah.
It's like,
And so it was a very fun night. It was a very successful fundraiser. Everybody should absolutely participate in the Women Have Options Ohio Bowl-a-thon.
I'm definitely gonna do it next year because I took bowling as my PE in college.
Nice.
So I
you're an
learned
expert.
I've learned the fundamentals
Okay.
of
Mhm.
bowling.
And actually, Women Have Options is funds abortions all throughout Ohio, but preterm, the clinic up in Cleveland actually runs their own fund as well, and their bowl-a-thon is actually this weekend. So if you didn't
okay.
donate to the Women Have Options one, you can look up preterm's bowl-a-thon and donate there too. So
Up in Cleveland.
Up in Cleveland.
And so can we promote that on our Facebook page?
we should totally do that.
We should. So if you're watching this, check out our Facebook page for information. If you still want to participate this weekend. So that's bowling. And then there's an election coming up next week. Jamie, what's the word on the election?
Yeah, so I always joke with people, actually not really joke, it's very serious. Like everybody votes in a presidential election,
Right.
especially the general one. Most people vote in primary. Some people vote for like Senate and the governor, and everybody thinks they're good.
Mhm.
But the laws that affect you every day walking down the street,
Yes,
who
local.
who runs your
Local.
city, who runs your police department,
Yeah.
are local. So, and nobody votes in those, especially primary. So next week, May 5th in Ohio is primary election day for your local offices. We don't do endorsements for those, but we definitely encourage everybody to go out and vote and to do some research on your own, on your candidates. There are candidate forums all over. I think there's one this weekend in Columbus. I know the Columbus Dispatch actually has talked to all the different local candidates and has all kinds of information on their voter guide on their website. So, take a look at your local
Yeah.
paper, figure out who your local candidates are, and get out there and vote in the primary next week. It is next Tuesday on the 5th.
Okay.
Rock the vote.
That sounds good. And then we'll give the last word to Randi.
So the NCJW, National Council for Jewish Women, is having an event at the State House. What's the exact
Wednesday,
date?
the 6th.
Wednesday, next Wednesday, the
Mhm.
6th. I believe it's from 11 to 12. I think that's the sign I saw. And so basically, it's called Walk in Her Shoes. And so they've been collecting shoes for months now. So that they can basically they want to take the shoes and make a circle around the state house, as a show, that's to show against all of the bans that have been put forth. And so we're planning on being there, and if you can be there, you should be there. They're also going to lobby their legislators, so they're going to have one-on-one meetings again. But I think it'll be good. I guess since that's being put on by National Council of Jewish Women. You can Google them, go to their website, and I'm sure you can get more details. But they're going to be doing that next Wednesday.
Cool.
Okay. Sounds good. I think that's all for us. We'll have our producer, Vanessa, if you want to turn us off. Thank